It wasn't too long ago that having a hysterectomy meant having one large incision. But today patients have access to DaVinci technology, and it's making a world of difference. Dr. Jody Hedrick returns from Mid-City OB-GYN. Good morning. It's always nice to have you here.
Good morning. Thanks for having me back.
So let's talk to patients here about this approach and what makes this different than a traditional hysterectomy, what we might have seen 20 years ago or even 10 years ago.
Well, many years ago, we did it through a large open incision about 2 centimeters above the pubic bone. And then technology has changed that we went with a vaginal approach, and now we're going straight with laparoscopic approaches. And we're trying to do this to minimize incisions for the patient so they have quicker recovery, quicker return to work, and less downtime.
We have some images that support what you're saying, and I think these are helpful to see. I sort of got it. The light bulb went off over my head when I saw all of this. So this kind of takes you through, as you were saying, that one incision, so that must have meant a lot of pain, and I would guess the recovery time was quite long as we look at this left image compared to those two middle images.
Yes, a lot of patients with the old total abdominal hysterectomy would be in the hospital 2 to 3 days, be off work at minimum 2 weeks, up to 6 weeks. But now with DaVinci technology and laparoscopic surgery, we can get the patients out of the hospital usually same day. Not everybody qualifies for that, but a majority do. And a lot of patients can return to work within 7 to 10 days.
But on the right, it almost looks like no incision at all because it blends in with the belly button.
Yes.
So is that in fact where the incision is?
Yes. With this technology, we're trying to do the patients all through their umbilicus or belly button, so it minimizes scarring, and so it makes it look invisible, like we were never there, and that's the whole beauty of the surgery.
It's just incredible. And the technology is extremely sophisticated. Once before, and this was about a year or two back, you were able to bring this in, and again today, the DaVinci surgical system. And in fact, Mike is standing by now with Dr. William Kuiper to show us, to demonstrate how this works. Mike, we'll send it over to you.
All right, thank you, Mary. This is pretty cool. I remember you guys were here about 3 years ago and we checked out the DaVinci machine. What do we have here? Let's talk about what's this portion of the machine?
Well, this is kind of the next step for DaVinci. This is the actual robot itself.
Yeah.
And what it's set up for right now is what we call single site DaVinci.
Which means basically
one
cut,
incision, which is what Dr. Hedrick was talking about. We make a single 2.5 centimeter incision in the belly button, and this little port here can be slid right into it.
Kind of ball that portion up.
Kind of goes right
put
in.
It inside the port.
And then all the instruments kind of go through that.
Yeah.
Whereas before we had to make multiple incisions,
Gotcha.
and obviously the advantage here is a lot less operative pain, post-operative pain.
The patient's laying on a gurney or a bed right here. On this side, let's talk about what we have over on this side, because this is the control unit that basically controls all that. Is this in the same
This is in the same room.
Yeah.
The patient is here, and we're sitting at the console, being able to operate the different arms and the camera for the DaVinci, and actually do the surgery from here.
Well, should I test it out? Because
want.
it's fairly easy. You have to know what you're doing
It's real simple.
as a doctor, but to control the robot, it's very simple. So let's try it out.
Well, the first thing I want to do, let me just sit down here and just show you real quick the different instruments. Here is the foot pedals. This is how you move the camera, and you have your head up in here, and your arms and fingers are right in here. And once you kind of sit down here, the arms will take control. If you hit the camera button with your foot, you can slide in. One of the things we show here is just the visualization that you can see in the high definition. You can actually see Lincoln actually in the memorial there. A lot of people haven't seen that. And as you back off, you'll be able to move the arms here and pick up these little rings and move them around. This kind of simulates some of the things you might be doing with surgery, moving tissue around, making incisions, and doing suturing. So I'll let you sit and...
Yeah, I'll sit. We were actually looking at where you would operate on the patient at the bottom part. Now we're looking at taking a look at the monitor.
Correct.
And I'll get in here, I'll squeeze in here. And I have not used this. We did not do a demo before, so I hope I do this right.
So just put your fingers in there.
Okay.
And you should be able to kind of tap the camera there, or you move them around.
Gotcha. And just the slightest move of your fingers moves the arm.
So if you take a movement and just kind of move around, you could kind of...
It's incredible. And so you can grab these, and you can come from an angle and twist and rotate.
Correct.
Grab pennies. In your case, you're going inside and you know which body parts to use.
Exactly.
That's incredible. What does this do for the patients in terms of recovery time? How long until they get can go home.
Well, that's the amazing thing about this. Before, where patients were in the hospital for 2 or 3 days recovering, the post-operative pain is a lot less with this. We're sending a lot of our patients home the actual same day they have their surgery.
Gotcha. And then from the time they can go back to work?
Back to work as soon as a couple days. I had a patient the other day who told me she went back to work the next day. You know, don't necessarily advise all that, and it does depend what you do, but you know, the post-operative pain is a lot less than when you have traditional surgery.
It is. And you guys were one of the first to have this DaVinci machine in the metro, weren't you?
Correct.
Talk about your history with it.
In addition to that, we actually are the first ones who have done the single site here in the Omaha metro area, and we're really happy to have that available here at Mid-City.
Yeah, it's incredible. The potential benefits of the DaVinci technology, what do you see in the future, and what are some of the other benefits?
Well, as far as the future, I don't know how much more minimally invasive you can get. At some point, we've got to get into the abdomen to do the actual surgery, but I imagine things will get smaller and smaller. You know, at some point, these could even be done remotely, you know, and I'm sure this has been tested for battlefield or you know, from one's office, but currently everything is within the hospital, in the same room.
Sorry, did I just pick up the whole?
Did you pick it up and move it around?
I picked up the whole unit here. This is incredible technology. Mary, let's send it back over to you to get a little more information.
Mike, this is amazing to watch, but I can tell you, seeing the difference between you and Dr. Kuiper, I'd much rather be in his hands right now. But then again, he is well trained, and I think it's great for our viewers to know that Dr. Kuiper and Dr. Hedrick were the first doctors in Omaha to bring this technology to us, so quite experienced. But this isn't the only reason you're here today. You've also got the Baby Love Essentials Baby Fair coming up, which brings us to all of the moms and dads who are expecting now. What will they find on September 14th?
I think there's going to be numerous vendors there. A representative from our office will be at the baby fair, Latrice Martin. She's our nurse midwife, and so she'll be there to meet and greet patients and address any questions that they may have while at the baby fair.
The website for that event is omahababyfair.com, and if you're interested in sort of meeting Latrice, she was here on the show a few weeks back, and if you go to our website under past shows and type in Mid-City, in fact, you can watch that clip where Dr. Hedrick and Latrice were here. If you would like to make an appointment, learn more about this technology, learn more about the services at Mid-City, we invite you to call 397-6600 or log on to midcityobgyn.com. To the DaVinci staff, thank you all for coming in today and setting this up for us. Dr. Kuiper, thank you. Dr. Hedrick, we